Hello, everyone. My name is John Chege. I'm the co-founder for Magic Foundation Africa. And with me is the president of Magic Africa, Riziki Sionboa. First of all, I would like to thank Kenyatta National Hospital research team for giving us this podium. And I leave it to the president to talk about the growth hormone challenges as GHD. What we encounter and everything else. Thank you.
Hi, John. We are unable to hear Riziki. Can we confirm if she's on with us?
Can you hear me? Hello?
Loud and clear, loud and clear.
And what about Riziki?
Can you hear me?
Yes, I can hear you now, Riziki.
Okay, let me start again. My name is I'm the president of Magic Foundation Africa. And this is a patient advocate organization that was created to form awareness to the general public about the importance of monitoring children's growth. So I will speak on International Growth Awareness Day. And then on it also there are subtopics like about the group, about the GHD, challenges faced by endocrine patients, and the solution. So to begin with, so MAGIC stands for Major Aspects of Growth in Children. The Magic Foundation Africa is a registered charitable non-profit organization that was created to provide support services and awareness to families of the children afflicted with various chronic diseases. We aim to spread awareness of the importance of observing and monitoring children's growth. We are a patient advocate organization. We are also members of ICOSEP, which stands for International Coalition of Organizations Supporting Endocrine Patients. Magic Africa works together also with Magic Foundation Kenya. Magic Africa is affiliated to the Magic Foundation USA. So our role as Magic Foundation Africa is gathering information on specific conditions and illnesses, helping patients navigate their treatment and care options, identifying areas where more or better care is needed, supporting patient rights. Do you know your rights? Educating and walking patients through the management of their disease or chronic diseases or illnesses, establishing a network of contacts in the sector of medical service providers with medical practitioners and with pharmaceutical and medical research to provide patients with the help in the care and management of their diseases. and providing emotional support for patients. So here, basically talk about International Growth Awareness Day. This happens every 20th September, and it is a worldwide event organized by ICOSEP. ICOSEP provides a global network system for endocrine medical societies and patient organizations to communicate. It aims to raise awareness among the public and health professionals about children's growth conditions and the importance of understanding children's growth rate. Did you know that growth delay indicates an underlying serious medical condition? There are hundreds of conditions that affect physical growth in children. So why is it important to monitor your child's growth? One, to ensure that the development of your child is on track. To act early if there are signs of potential development delays. Early treatment helps to improve child's general health, skills, motor, and abilities. So how do you monitor? Let me see that. How do you know that your child is growing normally? Through the growth chart. When you're taking your child for those clinical visits and the vaccines, let it not be a day of baby's day out and photos. Let it be a day where you're very keen to observe what the nurse is doing when it comes to taking measurements of the child's growth and height. Because every little growth or too much growth, it indicates there is underlying problem that needs immediate intervention. So the other thing is medical examination. And then there is the physical assessment where you compare your child with other peers. So what happens when there is too much or too little growth? When the child's growth remains at the same state or grows slowly, the nurse or the caregiver will give you to a pediatric endocrinology. This is a doctor who is specialized in children's growth and hormone, where he or she will conduct tests like blood test, growth hormone stimulation test, bone age x-rays, brain MRI. Growth hormone deficiency, stroke, short stature. This is when the body does not make enough growth hormone to allow a child to grow at a normal rate. So what are the signs and the symptoms of growth hormone deficiency or short stature? They normally have a slow or flat rate of growth, low blood sugars, that's hypoglycemia, muscle weakness, teeth that come in late, in boys a small penis at birth, delayed puberty, a younger looking face than what's expected for his age, appeared hair and nail growth. Some are chubby-like. So what is growth hormone? Like I said, I'll just touch on like a layman understand because this is not our field of expertise, but it's just what we have seen and observed. So it is a substance in the body that helps the kids grow and develop. It is produced by our brain's pituitary gland, and it governs our heights, bone length, and muscle growth. So how is the growth hormone deficiency treated? It's usually through they are given the growth hormone shot every day. So the most important thing is not the diagnosis and care. So what happens when you take a child to a pediatric endocrinology? The endocrinology now does specific tests to confirm indeed the child has specific condition. And you find that those children with slow growth rate, there is something associated with it, either delay in speech or motor. So besides finding out that there's a problem with growth hormone production, the pediatric endocrinology will also direct you to other therapists to ensure that the child grows all round in all the areas when it comes to the growth, when it comes to either the speech, when it comes to physiotherapies, you find that all is dependent in helping the child achieve the potential growth in all areas. So what are the conditions, the diagnosis and care? The cost of consultation, therapist test, and treatment itself is expensive for an average earning individual. You see that consultation itself is a lot of money. Therapies, it's something it's ongoing. They are also more expensive. The test itself that are conducted are very expensive. So when it comes to someone who is not working or has other children beside this one with growth hormone deficiency, they see there's no need to waste so much on just one child. So the other thing, the challenges that we have as parents, that there are shortages of growth hormone worldwide. Most patients have stopped the treatment because they are completely out of stock. Patients are outsourcing from overseas and India, which is very costly. The other problem we have is the treatment itself is expensive. The growth hormone pen for 15 milligram ranges from 35 to 55K. And that's just one pen. And as the child grows, the dose also increases. Thus, they need to use more pen. Most in the adolescent can use up to 4 pens in a month. So the other challenge that we have as parents is most patients are not prepared mentally with the idea that their child has health conditions. Hence, take this information negatively and completely shut down or isolate themselves and let fate dictate the outcome of their child. The other problem is lack of awareness. Most don't realize the importance of starting this treatment early with the notion that the doctors and the hospitals are out there to profit from the patient. So the other problem is keeping up with the consistency of the treatment, even with the shortages. We find that the growth hormone is not available. You find out the available drug which is available is a different brand. So you're forced to start on a different available brand. The other challenge is we don't have support from insurance companies. As an advocate, I've been privileged to meet with other parents from other countries. You find countries like Europe, they know how important growth is for a child and how it plays an important role when it comes to their development. So that all the cost when it comes to consultation, therapies, when it comes to the treatment itself, it's fully covered by the insurance company. Even the orders for the pens, they know that this child requires a specific pen during this time of the month. You see, there is those funds set aside to cater for such needs. The last one is parents see this treatment. Parents see this treatment as a harmful treatment because it's a daily shot and it's like an injection. They see it that we are putting more harm to the child. They don't see there are health benefits associated with this. So how can the hospital and the government assist? Well, they can encourage follow-up and check-up for every child's growth pattern to be mandatory and observed keenly during clinical visits. The other thing, thyroid test to be mandatory for every newborn in private and government hospital. Because it's to my knowledge that it's only private hospital that conduct thyroid tests. You find that there's no need for a child to start on growth hormone if there is something very small when it's related to thyroid. thyroid, they can take the tablets like daily. They don't need to go to the extreme of using the growth hormone. So if these tests are being carried immediately when they are born, the parent is able to know what they're dealing with when they're in the infancy stage. They don't have to wait until the situation is completely blown out to the point there is no point of recovery. The other thing is the government can work with NHIF to cover costs for treatments, medication, cost, therapies. Because some will require this treatment from infancy until they attain their full heights. That's in the adolescent year. So we are looking at someone who will use this medication from maybe year 1 to until they're 17 years. But depending also with the condition of the child, it could be a lifelong treatment. They can also assist by ensuring that each patient is given equal opportunity when it comes to medical access. Another point is allow different players of growth hormone companies to give patient options, because currently we're only dealing with one registered pharmaceutical company. The government can work with other African organizations. A good example is the African Union Development Agency with the evaluation of medical products for the treatment of priority diseases like hypoglycemia. Like I mentioned earlier, hypoglycemia is related to low sugar, and you find that the patient is not necessarily diabetic, but the low sugar is somehow affected by low production of growth hormone. So we find that such patients will require that treatment to help stabilize the sugar levels in their body. So it's more of a necessity than for cosmetic purpose. The other thing the government and the hospital can do, they can work with the African pharmaceutical companies to harmonize regulation of this product in the African countries. It is a sad scenario that we don't have access to this medication in other countries. We have to go to countries like India, European nation, and you find that transporting such medication to where it's needed, it's also a lot of work. The other work ways to ensure there is enough storage for medication of this growth hormone to avoid crisis like the one we're having. We find that there are shortages of the growth hormone since last year, December 2022. The parents have been left to fend for themselves to look for the growth hormone themselves because the pharmaceuticals don't have them in the storage. And then the most important thing is to allocate a special day for free screening and medical checkup for all children during Growth Awareness Day, which is every 20th September. Some countries carry out this initiative for even a week. So I believe early diagnosis is the key to saving and changing the lives of children living with endocrine condition. You can visit our website, which is www.magicfoundation.org or www.icosep.org to learn more about the different conditions, because there are over hundreds of conditions related to growth hormone deficiency. Thank you for having us. So we're open for any discussion, any questions. Oh, Nixon, at what age can one seek for endocrine check? The minute you realize that the growth pattern of your child is not going consistently, you find that they're growing slowly. You've gone, they have added like a few parts, and then the height is always there. It's not moving as it should. It should be a raise of concern to request to be seen by a pediatric endocrinologist. So we am I doing?
Hi, Riziki and John. Are you still with us? Hello? All right. Can you just give us a few moments while we try and contact our panelists today, and then we will resume in a few moments. Thank you for joining us and staying with us.
From John. Joel, how cases are we talking about in terms of available data? Sorry, I didn't understand that question. Can you be clear? In Kenya or Africa for that matter. Magic Foundation Africa works with patients in Kenya and in Africa. We are also members of ICOSEP. I hope I've been able to answer you, Joel. Any more questions? We need to improve anyway in government hospitals. Mom will get in clinic, like 5 of them, do everything in a hurry. And then the next group, like autism, mother, you need to breastfeed this, talk with the child, and that where you're dismissed. That's very true. All I can say, when you find there's a delay in any way when it comes to your child, I want to urge parents to always ask questions. Don't be afraid to ask as many questions, because you know your child way than the doctor. The doctor comes in with the diagnosis, but if you see that there's any delay of whatever, when it comes to speech, when it comes to motor, when it comes to anything, and you compare that child to his or her peers, you're in a position to ask the doctor, why are there delays with my child? What can I do to help my child reach to their potential in all areas? I hope everyone is able to hear me. Okay. Hillary, would it be wise to do a CT scan and growth hormone study soon after birth to determine how well the child will grow and perform? That one you can request, but it is after, like I said, it's easier to indicate there's an issue with your child through the growth patterns. It's now upon the nurse or caregiver to see indeed this child is not thriving, and then they will direct you to a pediatric endocrinology. I sent an email last week, no ticket was raised. Are you working on it? Which email address did you use, Susan? Roger, can it be made a mandatory screening test? That's why I'm raising awareness that they do it every 20th. Actually, other countries, like I said, they can go for up to 1 week so that they can reach out to all the children. And that's our aim and purpose of the group, to spread awareness from here in Kenya and throughout Africa, because we really lack awareness of how important it is to be monitoring our children's growth.
Recommended for clients for subsidized free screening.
Kuna maswali? Abraham Charos, why doesn't KEMSA procure the growth hormone just the way they procure other medication to supply to hospital? Because growth hormone in itself is a very delicate medication. And actually, they come to hospital upon request from the doctors. According to the number of patients the doctor have, that's when they request. But unfortunately, at the moment, the growth hormone are completely out of stock. So we're outsourcing from different countries, either Turkey, India, or European countries. So there's been delay actually all over. It's a global issue. Where can we refer clients for subsidized free screening? Unfortunately, we don't have any. That's why we are raising awareness to see if we can get a group of doctors and hospitals who can come up together to help us with this initiative of free screening to be at least conducted at least once in a year, every 20th. I think it will benefit most people and also children who are unable to have such services. Would it be wise to do brain CT scan and growth hormone studies soon after birth to determine how well the child will grow and perform? This one, I think it's wise to ask the doctor because they're in a better position to assist you more. It's safe to say it's for them to assist you in that area because also brain is very delicate. So that's their area of expertise. Lois Momanye, no, it is not a disability because normally what we have, a child is born normally. But now they start having issues along the way, which can be seen, but maybe the parent is not keen, and you find that some conditions are very severe. And when you don't address the issue at an early stage, a healthy child can end up become fully non-functional. So growth really plays a very important role. If you're able to know what are the indicators that the child is not growing, and then the doctor is able to diagnose the condition, it's easier to treat that child, and the child is able to live a normal, healthy life, and they can be fully independent to be productive individual in the country. So it is not a disability, it is a waiting possibility to become a disability if it is not addressed early.
How many cases are we talking about in terms of
Monica? How cases are we talking about in terms of available data? Actually, there are so many cases, like I said. There are many cases, over hundreds of them.
Yeah, how many cases? How many cases in Kenya?
That one, I'll let John answer the question regarding how many cases. Yeah.
How many cases in Kenya? Hmm. Efficiency. How many people do you know? How many people in Africa do you know? How many people in the world do you know?
Sorry, I'm saying we are many because I'm dealing with parents here in Africa, Kenya, and other countries in the continent of Africa. There are so many cases. Like I said, there are so many different conditions. We managed to mention a few in the in our website, but there are more than that. Hilary, where is growth hormone deficiency is prevalent in Kenya and why? Growth hormone deficiency, not only in Kenya, but everywhere. All I can say, people are not aware of this condition. That's why we are raising awareness. Growth hormone deficiency has been there. It's called short stature dwarfism, but you find that they don't necessarily have to have those features of dwarfism. Some can be indicated through blood tests. So this is an information that needs to be out there in regards to growth. Yes, because there are many factors contributing to GHD. Flora, thank you. Thank you. I'm looking down at the question. Thank you. Thank you for raising up this awareness. My child stagnated from 5 to 12. 2 years, several tests were done, but none remembered this growth hormone. 16 years down the line, I'm struggling with low performance in school, but could be mandatory to do assessment for all. Very true. Thank you, Lois. Hope your child is thriving at the moment. Where can I, Elijah, where can we refer clients for subsidized screening in Kenya? Unfortunately, there are no free screening, but like I said, we are raising awareness. We'll put down, we'll share with the research once we get this information, because that's why we're raising awareness, so that we can have the free screening for children throughout the country and possibly throughout Africa. So yeah, I'm open to more questions. Hope I've been able to answer all your questions. So any more questions? Okay. Thank you then for having us. It was a pleasure, and I want to thank you again for hosting us. Thank you so much. You can find us on our website, which is www.magicfoundationafrica.org. Social media, we are on also Facebook, Magic Foundation Africa. Yes. Thank you, and I hope the information it was beneficial to most, and it was enlightening. Thank you again for having us.
There's another question.
Sorry, there's a question.
Research study on our children. We organize assistance funding. Hillary.
Hillary, if I want to do a research study on our children in one of the counties, would your organization assist in funding? Unfortunately, we do not offer funding. This is a support service that, like I said, it helps to create awareness, to inform parents of the situation, and also direct you to where you can get assistance if need be. But unfortunately, we do not assist in funding.